anytime. Next, can you see this?
Yes, Doc.
Okay. So this is an ECG of a ventricular tachycardia. So when you say ventricular tachycardia, uh, tachycardic ang imong ventricles. So you can see there is a kanang shortened ang interval sa imong QRS complex. So there are two types of beta, polymorphic and monomorphic. When you say monomorphic, same siya og morphology imong QRS complex. So kana, di ba? Kita nimo. Then for polymorphic ventricular tachycardia or polymorphic VTAC, lalahi o shapes or morphology ang imong QRS complexes. So this is a fatal arrhythmia which could lead to cardiac arrest. Next is atrial flutter. So kani siya. There is regular intervals of your QRS complex, but as you can see, multiple P waves. Muna imong sawtod pattern. Then, one of the most or one of the scariest na ECG findings is ventricular fibrillation. So chaotic pattern of your QRS complex. Diba? So usually this is a patients with VFib are usually in arrested state. So gina-CPR na sila. Lastly is supraventricular tachycardia. So it looks like a normal sinus tachycardia, but usually the heart rate for these patients usually exceeds more than 150. Sometimes they go up as high as 250, and there are no discernible B waves. Okay.
Doc.
Yeah.
Doc, napamit isa, Doc, no kato bitang torsades, Doc.
Okay. So torsade po is just a variant of your VFib. So it looks like this. Asa to siya? It looks like this, pero na siya twisting sa center. So ato i-search siya. This one. Sorry, it's a variant of a your VTAC. Kana. So you can see, di ba? Ga VTAC siya, polymorphic VTAC, then mo siya ginatwist dito sa middle. Mo siya ginatuyo.
Wala na yung percent daw.
Sorry. Kana, makita ninyo?
Okay na daw.
So it is a variant of a VTAC of your ventricular tachycardia where there is polymorphic VTAC pero na siya twisting. Makita ninyo ang cursor?
Makita daw.
Oo. So kani siya, mo siya twist there. Mo siya ng knot bitong imong gituyok. So that's your torsade po. That's VTAC yapon, but it is a fatal arrhythmia that could lead to cardiac arrest of the patient. So I have one patient when I was in residency. I think that was 2022, and the patient was very young. I think 26 years old. But because of the uncontrolled hyperthyroid problem, the patient eventually went into VTAC and torsade po. It's pronounced as torsade po. So, unfortunately, the patient expired. So, yeah. So, any more questions before we end?
Quick question lang, Doc. Kawas sa ECG, Doc, baga na ginamata-mata ra na din niya, Doc. Mag readings.
Eventually, murag mako na mo siya kanang because exposed naman mi sa multiple na mga ECGs, eventually maanad na mong mga mata, oy, irregular lagi ni, oy, AF lagi ni. But sa so good is gina mo siya kanang tawag nami pattern sa pag-check ana. So I don't know if you will have an ECG reading ng lecture, but memorize this kanang mnemonics sa pag-interpret sa ECG na Rahim. Sorry, wrong spelling. Sorry. Rhythm. Axis. Ischemia. Heart. That one. So when I read the ECG, I usually use this pattern. So I check for the rate, I check for the rhythm, I check for the axis, I check for if there are signs of hypertrophies or hypertrophies. I check for if there are signs of ischemia or infarct or miscellaneous is mga intervals. So AV block, mga bundle branch blocks. Then I usually start with kanang contiguous leads na ko siya. For example, akong gina-type lang ha. So, inana akong sequence in checking ECG. So, based na ko siya sa walls. Okay. Any more questions? Sige lang, first year pa man po mo. So, you will have more time to encounter more ECGs. Any more questions?
Doc, sa kuan Doc bata, kani sa Frank Starling Doc, di ba kato ng curve Doc, no?
Curve?
Oo.
What do you
Nakakuha ko tong sa curve niya. Akong kuan lang Doc kay ang niyang kuan Doc kay magka-influence bang viscosity sa blood?
yeah. So, ang Frank Starling's law is heart. It usually pertains sa katong pag-stretch sa cardiac wall. The more it stretch, the more it generates kanang force sa iyang pag-contract. That's also the principle that sometimes will decrease lang cardiac output because increase mo po ang blood return, but if maghatag ang fluids, then you chamber, stretch siya, and it increases your cardiac output. So, bumalik ang BP.
Thank you, Doc.
Okay. Any more questions?
Sa synthesis na, Doc.
Okay, sa synthesis, so atong synthesis is on Friday. Let's start earlier, mga siguro 8 or 8:30. Sige. So, kasi
Okay.
mag-take
Pwede mag-on cam tag.